Welcome to our Wednesday. No, Thursday. Help me out here, guys. It's Thursday, almost Friday, isn't it? So, wow. Hey, welcome to our Thursday call. This is going to be our health training every Thursday at 11 o'clock Darren time, right? And 12 Eastern, just noon Eastern, if you guys had a remember it. All of our trainings, we're going to look at trying to keep them at one time across the board. And we decided moving to 12 o'clock Eastern time, 11 o'clock Central. Give these guys on the West Coast a break, let them wake up, get a cup of coffee, and about 9 o'clock be joining in. So as Agents First grows, we got to be more cognizant of other people and where they're at. And we got agents all across the United States. So we're proud of that, but we also want to kind of cater to them and give them an opportunity to be here, right? So that's why we did that. We're going to start doing this at noon. I'm really excited about this health opportunity, like more than you can imagine. I've been talking to a lot of people lately, and if you are watching the news and paying attention, dude, that's what the hot topic is healthcare. Like that is what everybody's talking about right now, other than Epstein, right? So, but throw out Epstein and focus on healthcare. That's what everybody's talking about today, and we want to hone in on that and take advantage of that opportunity. So, having said that, welcome to the call. I think we're going to have a lot more on here shortly. But you know what? If not, we got about 15 to 18 people on here that's excited about healthcare, and that's okay. We're going to make sure that you guys get on this thing, you start blowing it up, and as you start selling and promoting your numbers and doing well, we'll have 1,800 on here selling because it's going to start with you guys and setting the example. So, having said that, we've got a couple people I want to introduce to you today. You all had a chance to meet Jamie, and but now we're also going to introduce her boss and Tom. So, Tom, why don't you say hi to everybody? And
You're
you're
muted.
muted, Tom. Click on your button. I don't know if you can see it. There you go. You're good.
I'm
Oh no, he's
unmuted.
still
How
muted.
about, whoops, am I good now? Can you hear
You
me?
are now. We hear
All
you,
right.
brother.
Well,
Tell,
happy
tell us who you
Thursday
are.
and thank you for having me. We're excited about being here and enthusiastic about working with you.
Yeah. So what do we got? Tell us about Tom. Who are you, Tom, and what do you have to offer? Uh,
Sure. And out of curiosity, I did put a few slides together. Is it possible we could set this up to where I could share?
yeah, we have it set up that way already, so you should be
Excellent.
able to have
I'm
control
going
of
to go
this
ahead and
here.
open my screen and
You got it, man.
I'll
There you go.
give you some good info specifically for our meeting today. So, anyway,
Perfect.
happy Thursday. My name is Tom Yakopin. I'm the National Marketing Director and founder, really, of New Era Health Plans. I got licensed in 1985 as a very young man, wet behind the ears and full of bananas. I went to work for MetLife in New England from 1985 to 1988. And I left them and started selling health insurance as an independent contractor with an agency nobody's ever heard of for an insurance company probably nobody's ever heard of. Straight commission, 1099, selling a catastrophic health plan with a few basic riders. And frankly, it was challenging, but it was the best decision I ever made. I became a dedicated and solid producer, winning my first leaders conference in 1989. And from 1989 to probably 1986 was a continual leaders conference or president's conference producer, writing probably about 20,000 a week back in the day, which was a lot. I got into management by default simply because I'd write a lot of business every week and people would come ask me at the end of the meetings, 50 or so agents, how you doing this? And my manager noticed it and he said, Yak, I'm going to offer you an opportunity to get into management. All you have to do is keep doing what you're doing, but field train agents. I never want you to be alone. So that was my foray into management. I built a great district in Baltimore, Maryland at that time with UGA, which was affiliated with the National Association for the Self-Employed, NASE, under the leadership of Ron Jensen. I started building an agency. I moved to Cincinnati in 1990 to open a division with that company. And again, this is all self-employed. I had to have the money to fund it. I had to have the money to move, open my office, hire a staff, and I started recruiting and training agents in 90 and uh, just have had a great career. I stayed in that niche to and through when the ACA, the law was passed, which really disrupted and radically changed health insurance. I mean, we just didn't know what it looked like, what it was going to do. Were companies going to use brokers and agents? They were talking about navigators and all of that. And it was then that I reached out to Dave Collette, who I knew in a previous life with National Health, about this Philadelphia American product, which was just different enough to get my attention. And I'm very glad I did. It was the best decision I ever made in my career because since signing that contract and going to work with Philadelphia American, I've been privileged to work with great agents. And trust me, any marketing organization such as mine is dependent upon good agents, which is why I like the name of your organization, Agents First, because that's my philosophy. Without solid producers, I have nothing. But my team has produced over $100 million in premium over the years with Philadelphia American, and just have done a great job. It's changed the lives of a lot of my producers, and it's certainly changed my life. And it's put us in a position where we're offering a product that is different, okay? And keep in mind, I have learned that in the marketplace, it's your difference that brings you significance rather than being the same as everybody else. If you think about Ford, they don't sell as many F-150 half-ton pickup trucks as they do by saying buy a Ford, we're just like Chevy. And that's what you have with health insurance today. You've got the ACA model, which radically changed health insurance to where if you want to write quote unquote qualified health insurance, right, where you could get a subsidy, et cetera, under the law known as the Affordable Care Act, you have to buy one of these plans that's either bronze, silver, gold, or platinum, all of which are guaranteed issue, no pre-existing conditions. They have the mandatory 10 essential benefits baked in the loaf, including maternity, pediatric wellness, health, preventive, 4 or 5 tier prescription drug card. And I knew then that if they bake all of that in the plan and force everybody to buy it, I just didn't see how it was going to be affordable, how it was going to work. And what you're seeing today, since the rollout of the ACA in 2014 to today, you're seeing that without feeding these large insurance companies, not billions, but trillions of dollars in taxpayer subsidies, it's just unaffordable. I don't believe anybody would actually choose to buy an ACA plan unless they were subsidized or unless they were so sick they just didn't have an option. Why? Because in many cases, these plans, what you're seeing in headlines, what I'm seeing on social media, on news channels, hearing on talk radio, is without these subsidies, many people, productive, typically working middle class individuals, their premiums are like 2,000 a month, 3,000 a month in some cases. I had a couple call just last week. They were paying 1,700 a month. I don't know why they were happy about that, but their premium without the subsidies going into 2026 is going to be $2,800 a month. If you do the math on that, $2,800 a month over a 12-year period, now it's 28,000, right? In 10 months, let's just round up another four. So they're looking at almost $32,000 in fixed cost plus deductibles per person up to two max of, I think, another 10,000 bucks. So before that plan actually kicks in and does much of anything, they've got 32,000 in premium plus another 10 or potentially 20,000 flesh in the game. I mean, it's just ridiculous. No thinking person, in my opinion, would look at those numbers mathematically and go, well, this is a great decision, great risk management decision. I think a lot of people are going, I'll do something else. I'll go with no insurance. I'll do a Christian sharing ministry. And I'm hearing a lot of those advertised on the radio. I just heard a direct primary care ad on KDKA on my way to the office this morning. So there's all kind of alternatives out there. And that's what we do. We are an alternative to the Unaffordable Care Act. That's what I often refer to it as. So I want to welcome you. You're in the right place at the right time with the right people. Sorry the logo didn't stretch very well, but I'm very excited. I don't know Darren or any of you that well, but what little time I've had to chat with Darren, he's a true professional, and we are very excited to partner with all of you. And I thank you for choosing to do business with us. I like to start off with truth, okay? Let me give you a good reason to focus on this, okay? And I know there's a lot of blue sky out there. There's a lot of people talking about great opportunities and everything else, but I just wanted to start the conversation with a picture of my top agent's 1099 for last year. And I'll tell you a story on this guy. Tim and I have worked together since 1996. I recruited him in Dayton, Ohio to sell for my organization at that time, Benefit Marketing Group. And he has been with me throughout all of my transitions uh, for many years. A trusted friend, very hard worker, very knowledgeable, very dedicated to the craft, his family, his kids. But I remember we were in Vegas when I first started with New Era, and we were in the swimming pool at a leaders conference. And Tim was troubled with where his business is going. He just made it through the changes of Obamacare, didn't know what the future looked like. And I remember him telling me that he had like, I don't know, almost 100,000 in unpaid tax liabilities. His renewals were falling off the books, which was happening to all of us during this transition. And he was very concerned. And I said, Tim, I think if you focus on this, you're going to do very well. Well, end of a long story short, Tim, last year in Ireland, we were just there. We flew out of the States September 1 to our president's conference, and that was in Dublin, Ireland. And he was our number one agent not only in my organization, but in the country. So he made a great decision. And as you can see, his 1099 from Philly was 544,008.06. So certainly became a profit center for Tim. Now, he does a few other things, he's not captive, of course, do whatever he wants. But Tim's smart, right? So he invests in what is making him the most money. And the thing about health insurance is that having sold life, and I think life's a great product, annuity is a great product, Medicare, do it all. But health insurance is really wonderful to market because it's much more transactional than relational. In other words, if you get a good lead, they're already paying for health insurance typically. So you know that they believe in the product, you know that there's money in the budget, and very often the reason they're going to choose to chat with you is you're going to talk to them about saving 30 to 50% on their monthly premium by thinking differently and looking at insurance and maybe changing their behavior a little bit, but looking at things differently. And imagine, if you sell 4 or 5 cases a week and you're saving people two, three, four, 500, 600 a month. By the way, it'd be a great time to talk to them about adding life insurance or what do you have for life insurance? So health insurance for me has been very, very lucrative. But it is also, I say this to any agent or agency owner, it's a great way of building your book of business because a lot of the people that you attract and sell my product to are going to be healthy, self-employed people. They're going to need life insurance. They're going to need retirement annuities. They're going to need Medicare someday. And if they get to know you, trust you, and like you, they'll come to you for all of that. Again, just to show you what people are doing, this was last week. We submitted about 490,976. And my top rep last week was Terry Bush, another guy that's been with me since 1998. And Terry is a prolific producer. He was the number one agent in the United States in 2017 and has always been a president's counsel. But if you look at Terry's numbers, one agent He submitted 96,000 in AV. I think that was about 11 package sales for Terry. But at 96 grand, if you take a look at your commission schedule, you'll see that, we pay X commission on our hospital surgical plan, little higher commission on the accident, little higher commission on the critical illness, little higher commission on specified disease. The net bundle commission's about 30% at the street level. So you're submitting 96,000. He submitted over 18 grand in commission for a week. And during open enrollment, I will promise you we're going to have reps, individual agents doing 100,000 or more a week. We're already sitting, Jamie and Darren, at over a 500,000 submitted for this week. So I fully expect us to get into the million a week zone, partly because I have a really good team, and partly because I have never seen an opportunity because of economic challenges, awareness, the way that the government moved toward sunsetting these provisions, which were slated to be sunset, by the way. It wasn't a surprise that's how the expansion of the subsidies was sold to the American people. So they're ending, and therefore there is a massive opportunity out there. Now you got to want it. And I realize that sometimes if you're successful doing something, one of the hardest things to do is change. But what I want you to know is that this checks all the boxes. This really does. This is a great opportunity. And because we do advance commissions, we pay advance commissions twice weekly. We deposit on Tuesdays and Thursdays. And because our underwriting process is relatively swift and simple, you put a deal or two in on Monday, you could be paid on Tuesday. You put a deal or two in on Wednesday, you could be paid on Thursday, etc. Fill the pipeline, you start making a lot of money. And in order to do this, what I want you to know and what I'm here to do is to help Darren help you. And Jamie, we're literally your servants. We're going to work for you. And what I want you to focus on is product knowledge. Learn our product, learn how we bundle our products together. Understand the ACA, your competition. I marvel that a lot of brokers, even in the underage health space, don't really understand these managed care HMOs and PPOs and EPOs and how they work and so on and so forth. And I can help you. In fact, the more you learn about the ACA and the more you see the wisdom of an indemnity product wrapped around with an expense incurred catastrophic plan, and then bolting on our riders like critical illness and adding our supplemental accident, you're going to see the wisdom of what we do. I want you to learn our underwriting. This is super important. And please, 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 please promise me that you will either print a copy of the underwriting guide or save it to your desktop. And I want you to read it, please. It is how we expect our agents to behave and how you interface with the company. You need to know when you get a lead, how to scrub that lead to determine are they really a good fit. You need to know what we're going to decline. You need to know what we may potentially rate up, and you need to know what's going to be a standard jet issue. And the only way to know that is to read the underwriting guide. So please do that. We're going to send each of you who attended the training today a packet on marketing with Darren's permission. It just sets forth some great proven ideas that we use for radio, social media, bulletin boards in local sub shops, things of that nature, but how to tell the story. You're going to find that harvesting leads for health insurance is easy. Again, it's transactional. If people are getting a rate increase, and some of them are huge, it creates pain. And Tony Robbins has said that is the number one motivating factor for change is pain, not pleasure. So people are looking for an opportunity, and all you have to do is position yourself as a thought leader and as somebody that has an alternative to the Affordable Care Act. In the marketing packet that you're all going to receive, we'll give you some great tips, even some ad templates that you can use and deploy, customize, put your name and number in and get going right away. I want you to learn a good sales presentation. I will tell you that our product is not the easiest thing to present, especially when you're bundling two or three different riders and components, which is the way you should sell this. But you have to learn how to be able to disclose the features, the benefits, any waiting periods that may apply in the state that you're selling in, and yet not confuse the consumer or overwhelm them. And I can help you. We even have a good sales template that you're welcome to have access to. I also want you to know that we, just like Agents First, you're going to find that New Era and Philadelphia American really value our agents. You are the king, okay? Our producers are king, man. And this company they do so much to reward producers. I almost think it's overkill sometimes. But I do want you to know that we have a trip on the table right now for April of 2026. It's not too late to qualify because you only have to hit 250,000 for an all expense paid trip to St. Vincent and the Grenadines, and that's going to be in 2026. So if you want to learn more about that, you're going to see that in your agent's portal. Another thing is beginning immediately, right? Submission period 11/17. Every bundle you submit, for example, a hospital indemnity plan with specified disease, if you submit those two, you're going to get a $150 bonus per bundle. If you bundle our indemnity plan with specified disease, submit and issue 15 through the 19, 200. And then there's a $300 bonus, submit and issue 20 plus underwritten bundle sales the same. So if you get 5 through 14, if you package 5 through 14 sales, 150 a bonus, 15 through 19 sales, $200 bonus. If you do 20 or more during this period of November 17th to January 20th, which should not be hard, you can earn per deal you submit up to $300 per bundle. And that's just bundling our catastrophic wraparound, which we can get into, and our hospital indemnity plan, which gives the consumer both basic and big bill protection. Finally, I want you to know, always optional, but the company, Philadelphia American, typically runs every other week home office training that you're always welcome to plug into. And I just want you to know it's available. It's available every 2 weeks, year round. Philadelphia American, actually, Vice President of Underage Health, Dave Collette, runs this with his assistant. I forget his name now, but it's usually very informative. And having said that, I wanted to kick off just by talking about like a 3,600 foot overview, if you will, to give you some indication of what we do. Keep in mind, Philadelphia American is a wholly owned subsidiary of New Era. New Era is a boutique company. We're not Blue Cross. We're not United Healthcare. We're not Aetna. But as John Savage said, the late John Savage, one of the greatest life insurance agents in the world from Toledo, Ohio, he said, well, Tommy, if big was everything, elephants would rule the world. So I don't care how big Aetna is or Blue Cross. I care how good they are. And Philadelphia American has received an excellent rating by AM Best, who's been rating insurance companies since 1899. And we manage just over 1,000 million, just over $1 billion. So we're big enough to pay your client's claim, and we're big enough to pay you. So it's a great partner to have. And I'm very, very excited to get to know each of you, to get in the trenches and dig deep to show you how we've helped agents like Tim and Terry and Mike and many others become prolific producers and make hundreds of thousands, even millions of dollars in commission.
Thank you, Tom. And we've
You're
got around
welcome.
33 people on this call today. And so good for you. Thanks for hopping on today. Good stuff. I love the bonuses programs that you guys have established, Tom. But that's really powerful. It should be easy to hit. Those numbers aren't big numbers, guys, like we've seen in other health or life companies where they make it pretty tough. These numbers are going to be easy to hit, especially with what the product that we have in front of us. What question do you guys have for us for Tom? Go ahead and just unmute yourself and ask away. Let's take advantage of having him on the podcast with us. And then you can also put it in chat and we'll read from there as well.
I'll jump in.
Thank you.
Hi Tom, thanks for being here. You
My
mentioned
pleasure.
KDKA, so that must mean that you're in Pittsburgh area.
Hmm.
Okay.
Yeah, I
Nice.
live
All
in Little
right.
Washington, about 21
Oh
miles
yeah.
outside of the city. Yep.
Okay. My question is, can you kind of go over a little bit the difference between like an HMO plan and an indemnity plan?
Sure. And this is going to be in generic terms, but an HMO plan, HMO stands for Health Maintenance Organization, and they were launched, as I recall, I think Kaiser Permanente was one of the first that I had ever seen in the late 80s. And the philosophy was if they cover every sniffle, hiccup, and nosebleed, i.e., preventive, et cetera, and provide all of that basically first dollar, their philosophy was they will mitigate the risk of larger catastrophic claims, therefore reining in healthcare costs, keeping premiums low, et cetera, et cetera. And that was the early sales pitch of the HMO. Today, what we see is that the affordability has not occurred. Most of the ACA plans today use HMOs as their model, and that means they have a very restrictive network. You can only see doctors and hospitals that are in the network. If you stray outside of the network, you have no coverage unless it's a medical emergency. So they're very restrictive and they're heavily managed. Um, that's an HMO. A PPO is a participating provider organization, and they employ a network as well, but they do pay benefits outside of the network. And then, you have EPOs, et cetera, that are kind of a hybrid of the two. But those are the two models, and that's basically what you're going to see in the ACA. A freedom of choice and indemnity plan like ours, in contrast, is very much like the health insurance that I was first exposed to in 1985, 86, 87. Uh, Back in the day, in fact, when you took your insurance license, you might remember the basic definition of insurance was a financial product to protect the consumer from unforeseen catastrophic loss. Okay. If you think about car insurance, right? Car insurance covers accident, collision comprehensive. If something happens to the car from the day you sign that contract with the insurance company going forward. Homeowners insurance, the same thing. But what has happened to healthcare, just to digress a bit, under the Affordable Care Act, when they started making these guaranteed issue, when they said, okay, you have to cover pre-existing conditions, they're violating fundamental risk management laws, which is why the ACA requires trillions of dollars of taxpayer money. And then, of course, every lobbyist in the whole wide world made their way to Washington, D.C. to make sure that their particular pet project got covered by these ACA plans. So they're loaded with all kind of stuff that I would contend isn't really insurance at all. Meaning, when you bought your car, you assumed the financial responsibility that when your oil needs changed, you change it and pay cash. You don't file a claim with your insurance company. When your tires need rotated, you don't file that claim with Allstate or whatever. Uh, Routine maintenance. Same thing with your house. When your carpets wear out, you buy new carpets. When your walls need painted, you paint them. Insurance fundamentally, historically, even health insurance, was designed to provide protection against, keyword, unforeseen risks. Okay, that's risk management. And then we underwrote, right? You had to qualify for the plan in order to get it. You couldn't come hooked up to an iron lung, nor can you with Philadelphia American and get covered, right? But the ACA provides all of those features and benefits, but we now see what that costs, okay? And what that costs is a freaking arm and a leg. Our indemnity plan is old-fashioned insurance. The consumer is buying a basic hospital plan, and it has stated benefits. It is the most transparent policy in the whole wide world. We have 1 unit, 2 unit, or 3 unit. The columns read up and down. Each policy we issue is 5 million lifetime. You can then pick a bucket of money, how much coverage the consumer wants to buy, up to 1 million per person per year. When they file a claim, we dip into the bucket, we pay the claim. Every year we fill the bucket back up. And then they have a reimbursement rate. They have the 1 unit, 2 unit, and 3 unit. And our plan is based on Medicare's RBRVS reimbursement schedule. You guys probably know that Medicare has a reimbursement fee schedule, original Medicare, and they use RBRVS as the guideline for that because in different areas of the country, justifiably so, a gallbladder surgery is more expensive in New York City than in Hazard, Kentucky. And so they have reimbursement rates that vary based on the consumer's zip code. We do the same thing. So our 1 unit plan is calibrated at 100% of Medicare RBRVS reimbursement. So we have the daily room and board rates, the ICU rates, the skilled nursing, and then the professional fees. On the 1 unit plan, we're going to pay the surgeon, the assisting surgeon, the anesthesiologist, the radiologist, the pathologist, and the attending physician, fee reimbursement that mirrors Medicare's reimbursement. Our 2 unit plan is going to be 200% of that. And our 3 unit plan is going to be 300% of that. Okay. So our hospital indemnity plan is designed to give people under age 65 basic hospital expense protection on a very transparent chassis per day for room and board and miscellaneous per day for ICU, et cetera, et cetera. And then we also offer a limited benefit grid for outpatient, which is where people primarily get care, right? Very rarely does somebody just pop into the hospital. Usually they see a doctor, they get an x-ray, they get some testing, and then if it warrants that, surgery or hospitalization. So you'll see a very transparent outline of benefits that we pay on the outpatient side. Keys to our plan is that all of our outpatient benefits are first dollar. They're not hidden behind copays or deductibles. Our same day surgery benefit there's no deductible. In fact, in states where we have a deductible on this plan, and certain states we do not because the insurance commissioner wouldn't approve it with a deductible. But in states where we have a deductible, our deductible is radically different in that it is a hospital confinement deductible. It only comes into play if the consumer's confined to a hospital. So basically, our product is consumer friendly, paying a usual, customary, and reasonable reimbursement rate on doctor visits, testing, therapy, same-day surgery, and hospital stay. Okay. Now, again, we can bolt on critical illness up to 50 grand. We can bolt on enhanced accident 2 units up to 4,000 per whack. And then we can bolt on an expense incurred, meaning after a deductible, it just pays 100% of all covered expenses, a catastrophic illness plan. And when you bundle them as such, you're still going to typically save a consumer 30 to 50% over an unsubsidized ACA plan and check all the boxes for the average person's needs. I use ChatGPT a lot. Okay, it's a great tool. And I got on there because I'm a nerd and I like to know things. But I asked ChatGPT statistically, can you scan the HCUP website, which is a federal website that analyzes morbidity, claims, loss ratios, things of that nature, and give me an estimate of how many people under age 65 ever file a major hospital or catastrophic claim. And the statistics are stunning because it's about 8%, meaning that, a significant portion of American citizens never under 65 never ring the bell for that catastrophic claim. And when you look at an ACA plan, unsubsidized, especially if you get into the higher deductibles, they're basically just a catastrophic plan. To keep it affordable, in many cases, they don't pay anything first dollar except preventive. And that's only if they don't find polyps for that colonoscopy, by the way. Our plan gives affordable benefits where most people under 65 actually need them and want them, and will use them. And we're doing it. We're delivering that at 30 to 60% less. Now, let's talk about freedom of choice. With our indemnity plan, you can go to any doctor, any hospital, anywhere. Okay. And you can also file the claim in such a way that we pay you the money if you want, or the benefits can be assigned and we can pay the hospital or the doctor. If you use our PPO network, which is built into our program, that's the Aetna First Health Network. If you use a PPO provider, you do not have to, but if you do, we have all those procedures via CPT code discounted, typically at about 40% off their fake price to begin with. But it's nice. It also gives the consumer ease of claim. You just go in, plunk down the card. Part of the PPO agreement is the provider files the paperwork, etc. You just plunk down the card, everything's adjudicated and paid, and the provider gets his money direct, whether it's the hospital or the office. Now, you ask, what's the big difference? The difference is that this really empowers the consumer. It gives them the freedom to choose any provider. Believe it or not, it also, for savvy consumers, and you might find this difficult to believe, but in the real world of healthcare costs, you may be surprised to know that if I go to Monroeville Imaging with a prescription from my doctor for a CT scan and posture as cash pay, say to Monroeville, I don't have any insurance, Monroeville Imaging. They have prices online, $488 for a CAT scanner, PET scanner, MRI. But if I go to that same place with an ACA plan and just plunk the card down, they might bill 2 or 3 grand for the same procedure. And a lot of people are waking up. What you're going to hear in the mainstream media is you're going to hear talk about price transparency and the scamming that is going on with billing, meaning in many cases, hospitals are asking for reimbursement for tests and therapy that are 3, 4, 5, 6, 700 times as much as Medicare reimburses for the same thing. Why do they do that? Because they can. Because nobody's asking this question. And if you want to set yourself apart from every broker in the whole wide world, start talking about the cost of care, not just insurance. Why is healthcare so expensive? Let me tell you a real story, and I don't know how much time you guys have, but September 1st this year, my honey and I, Melissa, sweet Melissa, I call her, I'm an Allman Brothers fan, but we were on an airplane flying to London and then to Ireland. And unfortunately, she had a stroke on the plane. And it was a severe stroke in a major artery in the left side of her brain. We landed in London and they emergency ambulanced her to Charing Cross Hospital in Hammersmith, London. They immediately did brain surgery, fixed the clot. They got blood flowing to the brain. But we were there in a hyper acute stroke recovery ward for 14 days. Following brain surgery, every test known to man pre and post op. My bill when I left London, and they never made money an issue, they just made care the issue. But my cash pay bill was under $20,000. So I want to ask you a question. Why would that stay in Pittsburgh Hospital have been $250,000 or 300,000? Why could they do it for 25? That's the problem. And I want to tell you another problem. Part of the problem are managed care insurance plans. You see, only in healthcare, ladies and gentlemen, you walk into a store to buy something as insignificant as tuna fish, and you at least look at the price. What's chicken of the sea cost versus the generic version versus, right? When you buy a car, you look for a window sticker, right? What's this thing cost? What's it have on it? Only in healthcare, when people are most vulnerable, which is repugnant to me, when a person signs into the hospital, they are signing a permission to treat form, but they're also signing financial responsibility. But they don't know what anything costs, and the hospitals don't post anything. And that is the corruption that is going on in the corporate health system. And that is what the corporate insurance system, especially with secret pricing behind opaque networks, okay? where nobody knows the price of anything until the. Let me ask you a question, and this is how I sell, by the way. If you went to a restaurant and you were paying, okay, you had 10 guests there and you were paying, and the waiter comes out, passes everybody out a menu and says, "Hey, we're going to have a great time tonight." And you get into the menu, but you can't help noticing there's no prices on the menu. How would you feel about that? I'd call the waiter over and go, "Hey man, how come there's no prices posted here?" How would you feel if he said, "Well, just have everybody order everything and we'll send you a bill in a couple of weeks"? Or how would you feel if he said, "Well, how are you paying? Do you have restaurant insurance or are you paying cash?" And what if you found out that if you're paying cash, everything's cheaper than if you have restaurant insurance? It's like that's how ridiculous the current system is. It's the more you learn about it, and if you hang out with me, you're going to learn about it. Okay, because what we're trying to do is not just sell boatloads of product, but we're trying to educate Americans on how to escape being ripped off by greedy insurance companies and Congress. And to be very frank with you, they lied to the American people in 2014. If you go to on the public domain, you could see many political lies. The average American is going to save 2,500 bucks a year with the ACA. If you like your doctor, you can keep your doctor. If you like your current insurance plan, you get none of that was true. And it's hidden in plain sight in front of all of us. So it's a miserable failure, and it's a miserable failure for many reasons that are not easily apparent unless you dig in. But we have a solution. And we have a very integrous solution that will work very well. By the way, I've carried this policy since 2017, and I've used it, thankfully, for nothing serious. Testing, therapy, a few broken bones, some stitches. And I age into Medicare in April of 25. So I probably have saved, by not buying an ACA plan, I probably saved 15 grand over a decade. It's in my cookie jar instead of a big insurance company's cookie jar. So I hope that helps answer your question. Any other questions, please?
Quite a few questions in chat. If you want to just kind of read through
Please
those.
go ahead and read them off and let's see
Yeah.
if we can cover them.
Let me get my glasses on here. So let's see. Started off, I think John had some. John is doing Medicare right now. We got a few agents that's doing Medicare. And so we'll start off with Craig. Craig's a school teacher, and he says, I need coverage for my daughter since I am leaving school. So, Craig, if you don't have your health license, talk to me after this call and I'll hook you up.
Oh, I've got my health license.
Okay, well, then say your own self policy, and we'll help you walk you through that. Okay.
Awesome.
They're asking about contracting. We'll get to that one in a minute. Great presentation, Tom. Thank you. Would you still suggest your products to replace completely subsidized ACA clients?
I would let the consumer decide. One of my agents in Dallas just brought up to me that they are converting heavily subsidized consumers from ACA to our plan. And some of the reasons might be network restrictions, things of that nature. But he also testified that he felt it was because of quality. In the corporate healthcare system, it's not uncommon today to call a provider that's in network and be told you can't see them for 2 weeks. Hello. Okay, I just think that's unacceptable. Or in some cases, an ACA plan might address most of the consumer's doctors, but maybe they want to see a pediatrician for the kid that's not in network. So they might buy even a small 1 unit plan. In addition, by the way, you can supplement ACA with our plan because our plan pays in addition to, right? Just like if you sell our SPD policy, let's say you sell a specified disease plan with a 50,000 deductible and the consumer has a $100,000 heart attack. Specified disease pays everything 100% over 100 grand. The indemnity plan is going to pay everything it's legally required to pay without coordinating benefits with specified disease. There are times where consumers get more money from Philadelphia American for a major claim between the basic plan, the catastrophic plan, the critical illness plan. They might get more money than there is bill. Okay, that can't happen with an ACA plan either. So this works very well, and there are a lot of ways to sell it. You can position it as a supplement to ACA. In fact, when you log on, when you go to the e-app, you're going to see one of the top questions. Is this an ACA companion plan? In other words, are you selling it to pay in addition to an ACA plan? So you're going to answer, and that's why. We don't do a lot of that. Usually we replace the ACA, but any other questions?
Well, a bunch of them here. So, then one of them asking kind of about the, with the government shutdown and what they're trying to do here. I guess, if let's say if the government says we're going to take away the subsidies, but we're going to give every American so much money to put toward health, is that kind of how is that going to affect what we're doing over here? If that's what, and you probably know what's going on there better than we do.
Well, I don't know how it's going to affect what we're doing. I know that the fact that the subsidies are slated to sunset under the law, and that's the way the law was written. When the Biden administration expanded subsidies under the Inflation Reduction Act, it was specifically a COVID measure. So they were slated to end at the end of this year, okay? And that makes sense because COVID's over. The subsidies under the Affordable Care Act are simply rolling back to their original intended purpose. Okay. So subsidies aren't going away. The expansion of subsidies under the COVID era, and it's just rolling back to the original law, the way it was rolled out in November of 2014. But what's happening is people are looking at the real cost of the insurance going, wow, because the subsidies created an illusion. My sister's a very nerdy girl. She loves words, but I remember a word she turned me on to some time ago. It's called obfuscation. It's a big word, but obfuscation just simply means like, just like in The Wizard of Oz, pay no attention to the man behind the curtain. Look at the smoke in the mirrors, right? So what the subsidies did was they masked the unreasonable and greedy insurance companies raising these rates to unbelievable proportions. Now you're just seeing what the stuff costs, and it's ridiculous. Okay. Now, what the current administration is proposing, and you're going to hear dozens of proposals. So I wouldn't subsidies, which by the way go direct to big insurance, which is ripping people off. And if you can't see that, I can't help you. So it'd be a better idea to just take the $1 trillion and give it back to consumers. What they do with it, however, I don't know. Because as always, you're going to have irresponsible consumers who just don't care, right? And they're going to go blow that money. And then they're going to complain that they don't have subsidies. And you're going to have people that invest it in something other than healthcare, and you're going to have people that use it for healthcare. But I could say this, that a free market is the best possible thing for healthcare. And don't let anybody fool you into believing we have a free market. Never forget this. When the Affordable Care Act was rolled out, they basically made anything other than ACA insurance illegal. Why? Good ideas don't need that. They also came out with an individual mandate, right? This is a great idea. And if you don't buy it, you're going to pay a tax penalty, okay? That's force. Good ideas don't need force. So I knew from the beginning this thing was ugly because a good idea, you just roll it out in the market and let consumers decide. That's how we sell. We just plunk our deal alongside these abomination ACA plans and tell them the truth. Here's what it covers. Here's what it doesn't cover. You decide. Do you want to spend 30 grand a year on that thing, or do you want to spend, 8,000 a year on this? You be the judge, Mr. Proud, and let the consumer decide. They deserve that. People deserve to choose. Some people might say, I don't want any insurance. Okay, great. No problem. Next, right?
Tom,
Yes, sir.
I may have missed it, but you said you can put this as a companion plan to a subsidized plan as a HIP plan.
You can.
Because like with Medicare, like dual eligible Medicaid, you're not allowed to put a HIP plan on top of it, but yours will work with a government subsidized plan.
Yeah, yeah. Just read the underwriting guidelines. There are limits on what you can sell, but yes, and it works very nicely for that.
And can you go over who all's accepted doctor wise? Is your plan accepted everywhere, or did I hear somewhere that it was?
Yeah, it's a free market health plan. You can go to any doctor, any hospital, anywhere, and the benefits that you see printed on that page we'll pay that under law. We have to. So let's say, if you have a plan that's paying $120 a doctor visit, you can go to any doctor. And if the doctor charges 150, we're paying 120 and you pay the difference. If the doctor charges 100, we're paying 120 and you keep the difference. Okay. Now, if you use our PPO network, which there's a provider finder right on our home office, you could search that. You go to one of the PPO network docs, plunk the card down, and they're going to bill whatever they bill. Then the PPO reprices it with the discount. And then the benefits are paid to the provider. And then the consumer gets an EOB showing whether they owe money or whether they get money. Okay.
That PPO network is connected to Aetna's network.
It's First Health. Yeah, that is a wholly owned subsidiary of that. Correct. And we just lease that. We lease access to it. Their logo's on the card. We pay them per month per member so that our consumer can choose to access that network, benefit from the repricing, and also have ease of claim. The claims, the forms are all done. But keep in mind, they can go anywhere. They can posture as cash pay, and we'll mail the money to them. It's up to them. And sometimes, believe it or not, sometimes you can negotiate a better deal cash pay than a network does. Okay.
Todd also asked if do your clients have to requalify for the plans every year? Is it a once a year underwriting or
one time underwriting? It's guaranteed renewable. Once they have the plan, we can't take it from them.
so?
Contracting pretty quick, guys. I got my contract in 2 days. I sent it in, filled it out, and within 2 days, had a writing number. Usually, you get contracted the next day. They'll give you the writing number, and you're ready to go. So in about 2 days, it's pretty quick. Your upline needs to get it, and then from that point, we'll get it down to you guys. So I would say by midweek next week, everybody here should have a plan. If you have a health license and you want this contract, go ahead and right now put your name in chat. And MJ, if you will, go ahead and start taking those names. And so we don't miss anybody. But right now, if you want this contract, go ahead and put your name in chat. And then we will reach out to you and via email and send those contracts out. Okay.
I have a question, and maybe you already covered this, maybe not. Are you paying renewals
Yes. Yeah. And when
on
you
this
see
plan?
your
Okay.
contract, you'll have a commission addendum, which will show you your first year commission, which is considerably higher in the first year. We heap the first year commissions and then we pay a renewal years 2 through 10. That's correct. Yes.
Okay.
And you're fully vested with us from day one.
And Todd is asking, do you have to requalify every year?
No,
Nope. Everything's guaranteed renewable to 65 on the health plans. I believe the accident plan renews to 75. So some of the products will renew a little longer, but guaranteed renewable to 65 once they have it.
correct. Yeah, we underwrite them one time. Once they get on the bus, they can stay on the bus as long as they want. We can't kick them off. They can get off anytime they want.
Beautiful.
But this is guaranteed renewable as it is. And by the way, that's a selling point because the ACA isn't. Insurance companies could take a plan that they're losing money on, they just take it off the market and they just move the consumer to something else. We can't do that.
Hey, really quick, Tom, thank you so much for today.
You're very welcome.
To you yesterday a little bit. What's the average rate increase once it's that the next following years are like 2 to 7%? It's I know it's not like
You
ACA.
can see like when you go in your agent portal, we have, we use an online application, but we also have paper apps with rates. And this is an age attained product. So your consumer is going to have a slight bump every year because they're getting older and they have fixed indemnity benefits that, cost X number of dollars per month per year. And as they get older, morbidity says they're higher likely to be sick. So there's going to be an annual age increase, but it's very nominal. Other than that, you're really not traditionally going to see inflationary increases on an indemnity plan because it's paying a fixed dollar amount, so much per day. So it's difficult for an insurance company to go to an insurance commissioner and say, I want to charge more for this year, when in fact it's not paying any more this year than it did last year. Now, on the expense incurred products, that's a little different, the specified disease, the accident plan, because they're not indemnity. They're not paying a fixed benefit. But that's another selling point. It's going to be affordable today, and it's going to be affordable long term. The other thing that I'll tell you, underwriting, underwriting has been demonized, right, by the government. Like people have been sold that it's horrible that insurance companies underwrite. So of course the ACA, big selling point, guaranteed issue, no pre-existing conditions. But you have to understand something. That drives the price of things up. So another benefit I sell is, Mr. Prospect, if people are complaining about the price, I let them know I can take you out of the ACA, which is in essence a high risk pool. And I can put you over here with a group of self-employed, healthy people. Because you have to be healthy to get this. And the other thing about self-employed people is they traditionally do not abuse health insurance. Let me give you an example. A farmer out on his tractor cuts his hand. Is he going to finish plowing the field, or is he going to go see a doctor? He's going to put duct tape on his hand and keep plowing the field. Self-employed are the last people to go into a hospital. They're the first ones out because they're laying in a hospital bed wondering who's running their business. They're worrying. So it's a very healthy risk pool. And I sell that to consumers. I let them know underwriting is actually your friend, okay? Because if you can qualify, you're going to be in a better risk pool of uniquely healthy people. The other thing I point out, because I do like to tell stories, imagine, guys, what if the federal government passed a law mandating that every November through December, every bank and every credit card company in the country has to offer loans guaranteed, no credit check, like whatever people ask for, they get. Okay. What would happen to the cost of money? Would it go up or would it go down? Think about that. That's no underwriting. And people that say, well, it's unconscionable that insurance companies underwrite. Well, banks underwrite. People discriminate all the time. Car insurance companies, if you're a horrible driver, you're not getting car insurance with a good company. Same thing with homeowners. If you keep burning your house down, someday the homeowner company is going to say, we're done. So underwriting is your friend, and I think it needs to be looked at more like that. It's going to piss some people off because some people aren't going to get our plan. But the ones that do, in all probability, are going to get more usable benefits for less money and be able to keep it as long as they want.
Hey,
Any
Tom,
other questions?
on that note, real quick. So in life insurance, obviously, if we get somebody declined, we typically have somewhere to go to, right? That we can kind of look at something else. In this scenario, we get declined with New Era or yours. Do you guys have something? Do you just go to the ACA at that point?
ACA is the only other viable option.
Go straight to ACA.
Yeah,
Okay.
so it's ACA versus us, and that's another nice thing because again, if you look at our plan and some ages, like here in Pennsylvania, we don't have the catastrophic wraparound. So we sell the indemnity product with critical illness, dental, and enhanced accident, and it does expose the consumer to large catastrophic claims. But we disclose that, we sell it with integrity, and we sell a lot of it, and it stays on the books. Because for most people, as I said earlier, only about 8% of consumers under age 65 are really filing major medical claims. Okay. But we always say to them, now here's the deal. God forbid you buy this basic hospital package and you're saving a lot of money. If in July or something, God forbid, you're diagnosed with pancreatic cancer, don't despair, right? You've got 50,000 CI, you've got a robust package of benefits. And in November, what am I going to do? I'm going to enroll them where? In the ACA with the January 1 effective. And usually, by the way, listen to this. Usually the consumer says, oh, that makes perfect sense. That's our fallback position. Yes, it is. And then I would cancel the Philadelphia American. I'd be like, oh no. Then you would keep the Philadelphia American. Why? Because it's going to pay, in addition to your ACA, it's going to pay all your premiums. You're going to make boatloads of money because now we know they're really sick, right? So now my plan, let's say for chemo, is paying 1,500 a day for chemo and radiation, 10 days, 15 grand. That's their premium for the year, or their deductible, or both. So that's the beauty to this, is that we can, it's kind of like with Liberty, 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 right? Pay for what you need. Okay. The ACA doesn't allow people to do that. I'm 64. If I bought an ACA plan, I'm paying for maternity, pediatric wellness, pediatric counseling, 5-tier prescription drugs. I don't take prescription drugs. Why the hell do I have to pay for that? Well, you don't have a choice because we're the government, right? We give people that choice. We're that choice. We are that alternative, affordable alternative to the government apparatus known as the ACA.
Tom, great question here by another Tom Kane here. How do you market the plans, and where do you get the leads? So let's talk to them about what we're going to be doing in terms of leads.
Sure. So my history with leads is deep, right? I actually owned a lead company when I lived in Chicago in '08 through, actually '03 through about '09. It was called Lead Dog Marketing. We created telemarketing leads and sold them to agents all across the country. But telemarketing leads, while they were okay, there was a lot of scam companies out there. There's a lot of internet companies out there, and I have become very weary of lead companies. In fact, I don't endorse any of them anymore, because I would endorse a company that maybe started off strong and I'd send 50 or 100 agents there, and then the company's overwhelmed. All of a sudden, the product sucks. And the agents are getting ripped off. And guess who they're pissed off at? Me, because I referred them. So what I tell agents, my most successful agents, honestly, create their own leads. Here's the beauty. It's not hard. Here, like, we're going to send you all a marketing packet, and it's going to show you some of the silly little ads we display. Like, I display one: is your health insurance premium making you sick? Call Tom, affordable health care, save 30 to 50% over ACA plans. Super simple. And market pressures, when people see that, if it's professionally produced, they'll call. We're on radio every day. My top agents, Tim Cooper's spending $150,000 a year on marketing. Radio, social media, some telemarketers, et cetera, et cetera. But he's making $500,000, so he's keeping the lion's share of his deal. And it's very easy for Tim. All of his leads are inbound now. He doesn't do any outbound calling. But the marketing pack that I'm going to send you is going to address everything: cold calling, hot knocking, telemarketing. Yes, you could still call a small business owner. Here's how simple it is. Ring, ring. Hi, this is Tom Yakopin. I offer affordable health insurance to self-employed in Washington County. Do you pay for your own health insurance?
Sure.
And they're going to say yes or no. If they say no, I don't, I get it through the spouse, I say thank you, next. If they say yes, I do pay for it, here's my question: are you happy with what you currently have? And they're either going to say yes or no. If they say no, I'm not happy, I say, well, here's my card. Would you be open to me giving you a call, maybe chatting about potentially saving you 30 to 50%? Very simple. You can walk into small businesses and do that same hot knocking technique. Do you pay for your own health insurance? Yes or no? They say yes. You go, are you happy with your current arrangement? A large percentage of people are going to go, hell no, I'm not happy. I just got a huge rate increase. Are you aware that there are alternatives to the ACA? See, one of the big things about health insurance is the government is pushing their apparatus. There's no national advertising talking about non-ACA plans. You're the outlier. So people don't know that there are alternatives. They just need to be educated. And it's simple to reach them. I would stay away from most lead companies unless you know that that they're generating an integrous lead. I've just been ripped off too many times by them.
Yeah, same here. We get that. So there's ways to do it. So Tom, you go into a small business owner all over the place. They're everywhere. Presented just like you did, but we also can present. I don't know if we do group, but within the group, someone asked me this morning, do they do like group things for like small business owners?
Yes.
Well, probably so individually through it, but I don't know. Tell me address that.
Yeah, absolutely. We call that voluntary or list bill. So we do, this is a great product. Shanice Wilson, one of the in-house agents just down the hall here, just spent time with a small business in Canonsburg called the Bar Association. They're a hip and cool restaurant, used to be an old law office. and the owner knows about me, friend of mine. Um, and I think they have 4 or 5 employees. Shernice went in, showed the plan. It's all voluntary. They can pick it, they could take it or reject it. One person can take, the whole bundle. One person might just want the dental or whatever. But I think she wrote 5 apps, and it's all going to be list build. We're going to bill the owner, who then can decide, do they want to pay some of the premium, none of the premium, or all of the premium for their employees. It's called a voluntary program. Now, it doesn't change the plans. The policies themselves don't magically become group policies. They're individual policies in a simple billing arrangement to improve the employer-employee relationship, because the employees get benefits through their affiliation with that particular company. And
So
it
we
works
have
very well
access.
for small companies.
You got to be able to help us if we get something like that going.
Oh, I'd
We have
love to help you. I have a whole
give
presentation
you a
training
call.
for the small group market, and it's a very lucrative market.
It'd be interesting. Yeah, I've got a pretty good sized business. Actually, we've got probably 60 to 80 employees, but maybe there's something we might look into. I've just got a good relationship there that maybe we can do something. I don't know. Well, look, me and you'll talk later on that one. But you guys are probably thinking in your head right now, some small businesses. You got to go get hairstylists or whatever. I hadn't seen a hairstylist in a little bit, but my wife does. She gets her nails done. But I'm talking about wherever, right? You just walk down the street, go to your local, community and just start walking in. There's ways to do this.
Oh, it's easy.
You probably can help us design maybe flyers, brochures,
Yep.
card, whatever it is. We can work with you guys on that and put something together.
That marketing packet we're going to send out has templates in it. It's ready to go,
I
guys. You're
figured
going to
that.
love it.
Love it. Love it. Okay. This is good stuff, man. Let's see. For contracting, it's from Lindsay. For contracting, does the upline have to hold a state? That's a great question. In order to get overrides, do we have to have, so let's say we got someone in West Virginia and we're in Florida. Do we
That's a
need to have a
Jamie
West
question.
Virginia
She's going to
Yeah.
jump in on that one. Go ahead, Jamie.
Yeah, I did. There are certain states that do require
Okay.
licensing and appointments to earn overrides. Florida and West Virginia are two perfect states to explain that. There's less of those than don't require it. But
Okay.
if you're bringing agents on, you want to be aware of those override commission states. Florida, New Mexico, Texas, Georgia, Virginia, Louisiana, Pennsylvania, West Virginia, and Wisconsin. And I do have that document so that you'll all have access so that you'll know what's required where.
Yeah, and those are typically the same ones that's going to be in the life side too that does that. So we probably have already got those in most cases, but we'll just make sure send those over to us and we'll confirm that. And we'll
Okay.
just if we got it downline, make sure we're getting you have those license in place just so you get your overrides. But
Yep.
we'll walk through that with you. Great question,
And
Lindsay.
and just so you know, if someone does come through, let's say, and they're downline, they don't have that licensing. Rather than hold up contracting for the agent, home office will go ahead and put that through, and we would just put them direct to you, Darren. And
Yeah,
then as soon as the correct licensing or paperwork is submitted, we'll just change the hierarchy around. So it doesn't delay the agent getting contracted.
that's important, and then we'll make sure that that person gets their
Yes,
if they want to get paid on it. Sometimes they'll
sure.
just I'll wait, right?
That's a good motive.
Yeah, it is. There are states that do require that. Was yeah, somebody addressed that. And Jamie, if you can send again the states that you guys are, I'm sure it's in that marketing
Yep,
plan, but make sure we know what states we could sell in. And the guys,
absolutely.
if you are in a state, I got some agents in New York. We know we don't sell in New York. We don't sell life insurance in New York, but that doesn't mean you don't sell life insurance with us. You just go out there and find you states that you can sell in. If you're doing Obviously, if you're going door to door, you're probably going to have to be driving a little bit. But that's okay. But we can definitely sell this on telesales.
Yeah.
Um, okay. Anything else? Let's see. This is
Let me hop in here and say one thing, Darren, that I want to do just to help you jumpstart things
okay.
is maybe you and Jamie can coordinate this, but I'm going to put an offer out that every one of your agents that hops on, when they get a writing number, if you can date that with Jamie and make note of, Joe Blotz submitted his contracting, became appointed on thus and such of a date. If they submit an app within the first 7 days, let's say the first week, I'm going to send them a $100 gift card just as a thank you for taking the time, reading the underwriting guideline, just as a way to say thank you for focusing on what we're doing. And you'll see the reward in it. But that's something I'd like to offer. And
Yeah.
to make it clear again, within 7 days of getting your writing number, get out there, write a deal, and we'll send you a gift card to say thank you.
And
Dude,
Darren, I will track that for you. You don't have
okay,
to do
thank you, Jamie.
anything.
I appreciate that, guys. Thumbs up for that, right? Put a one in chat if you appreciate Tom and offering that to us. So what a free $100. Everyone here, if you get your contract, you're going to go sell this, no doubt. So everybody here, go out there and don't just sell one, sell five, right? The reality is, if what do I say all the time? You can sell one, you can sell 10.
That's
If you
right.
sell 10, you can sell 100. Sell 100, you can sell, it's just duplication, right, guys? Sell one, then go out there and sell you 10 more.
I love it. And that is a fact, brother.
Yep.
And I want to say to you, I keep coming up with things. I'm excited about this. I'll bet everybody here, you might not even know it. Everybody here, you are surrounded right now with people that are in a conundrum. Okay. Meaning they're getting health insurance rate increases. They just don't know you have a solution. And allow me to say something I've learned about money. I'm a capitalist. I believe, in making plenty of money. Okay. But money is a reward for solving problems. Broke people don't have a money problem. Broke people fail to realize that you're here to solve problems in your community. Painters solve color problems. Lawyers solve legal problems. Doctors solve medical problems. We can solve one of the greatest problems facing middle class America right now. You can't turn on a TV channel, can't read the news without hearing about a healthcare crisis. So when I started becoming a problem solver, I stopped chasing money and started chasing problems to solve. Money began chasing me. So go out and focus on solving problems. Find people that have problems. And that's what you're looking for. That's what a lead is. Do you pay for your own health insurance? Yes. Do you like it? Hell no.
Right.
I have something that might be a solution. What a great way to live life. It's wonderful when I put my head on the pillow at the end of the day and have served people with integrity and solved problems. Yeah, might have made a couple of grand. I don't feel guilty about it at all because it's in exchange for being a true, integrous professional solving. So go out and solve a bunch of problems, and I will promise you, money's going to chase you because we have plenty of it. There's no lack of money. Dr. Chen, you can't send in more business than we'll pay you on. It's like a bank. You have an unlimited line of credit with our advanced commission system. Send in the business. We're going to send you the money.
Check this out. Yeah, now I've been thinking about this, but I wanted to address it. Guys, hand in hand. So think about the clientele that we're talking to, right? Because this is not your senior market. Your senior market is going to have the ACA or the Medicare, right? That's what Misha and Teresa and John is doing, right? Medicare.
That's right.
So this is prior to age 65. So you think of your clientele, business owners, people that are just like yourself. We have 33 self-employed business owners right here on this call. Every one of you guys, you don't have, unless you get health insurance through your wife, or maybe, whatever else, you probably don't have it unless you need it, right? How many people just like you are out there, small business owners that either have to go to the ACA plan and paying an extreme high rate and it's constantly going up, could use this. So think of all that. But here's something else to think about. Now we find those clientele. We find them, they're 35, 40, 45, 50 years old. They need health insurance. What else do you think they need? Could we not save them $500 a month, right? Because if we're selling this at 30 to 50 to 80% cheaper in some scenarios, at 30 to 50% cheaper, very, very likely saving them $300 to $500 a month. What if I told you, hey, Todd, I'm going to save you $450 a month on your health insurance. What if I could take the extra $450 a month on your health insurance, put it into our debt elimination program, and in 7 years, pay off your house, pay off all your cars, pay off all your credit cards, and totally be debt free in 7 years with that for extra money. So you're not spending any more money than you were doing. We're moving it and then what would retirement look like to you if you were totally debt free in 7 to 10 years? Guys, we just simply took the same thing. The clientele is already there. We found them because they were paying a lot of money on health insurance. We saved them $400 to $500. We took the money they were saving. We put them into our DEP plan, and now we're going to get them out of debt and show them how they can retire at 55 years old, debt free, with money in the bank. Isn't that a win-win for everybody? Thumbs up if you like that one. So yeah,
Perfect.
All
beautiful.
right, guys, I got to run. Thank you. It was a pleasure meeting all of you.
Thank you, Tom. You were incredible, and we'll do this again next Thursday. Okay,
See you then.
maybe Tom might
Awesome.
jump in and
Thank
say
you.
hi, might not. We'll have Jamie for sure. And guys, if you want to stick around after they leave, I'll be hanging out in Coach White's office, and you guys jump in my office and let's visit. Okay, good job. Thank you, everybody.
Thank you, everybody.
Awesome. Thank you, guys.